Have you ever wondered how veterinarians tackle something as complex as lumpy skin disease in cattle? Well, you're about to find out. Welcome to the world of applied veterinary medicine. Lumpy skin disease, or LSD, is a viral disease that affects cattle. In our previous discussion, we dove into the causative agent, risk factors, and diagnosis of LSD. Now we're delving into the clinical pathology, necropsy findings, and treatment. In clinical pathology, lesions serve as culture grounds for the virus, and numerous PCR assays can identify the viral antigen. DNA from viruses can linger in the skin up to 90 days post-infection. An antigen, ELISA, is often applied to early samples of the disease even before the emergence of neutralizing antibodies. The history of generalized nodular skin disease is also a crucial consideration. The histopathology of the lesions exhibits a granulomatous reaction in the hypodermis and dermis. Early lesions display intracellular eosinophilic inclusion bodies. The most accurate serologic test is virus neutralization, while tests for indirect fluorescent antibodies and agar gel immunodiffusion are less precise. As for necropsy findings, similar lesions can appear in a variety of places, including the intestines, pharynx, trachea, skeletal muscle, and bronchi. Pneumonia is also a common finding. Often, the lymph nodes on the skin are enlarged. Respiratory obstruction, typically caused by necrotic ulcers and surrounding inflammation in the upper respiratory tract, often results in respiratory difficulty and even death. Histologically, a broad vasculitis indicates the viral tropism of endothelial cells. Intracytoplasmic viral inclusion bodies have been reported in numerous cell types. When it comes to treatment, there isn't a specific one for LSD. However, it's recommended to use antibiotics or sulfonamides to prevent secondary infections. Control is mainly achieved by limiting the movement of livestock from unaffected to contaminated areas and vaccination. Commercially available, freeze-dried, live attenuated vaccines are most commonly used. Due to the antigenic similarity of capropox viruses, immunizing cattle against an attenuated sheeppox virus has been used to protect them against infection with the LSD virus. Remember, vaccination of a herd at the onset of an outbreak is not very effective, as most animals will already be incubating the disease. In such cases, improper needle hygiene could transmit the disease. To summarize, we've discussed the clinical pathology, necropsy findings, and treatment of LSD in cattle. Understanding these aspects is key to effective management and control of this disease. Thank you for joining us on this journey into the world of applied veterinary medicine. Stay curious, stay informed, and continue to explore the fascinating world that unfolds at the intersection of science and animal health.